students who have prepared all their lives to go to college are having doors shut on their faces because the money just isn't there.
This year, if lawmakers cut deeper into the muscle and bone of health care, education, and services for the elderly and disabled, Washington will not recover for years. We expect the state to provide quality education for our children. A new round of cuts would increase class sizes and cut early learning programs. All 220 school districts in our state would lose funding. More cuts in education in other areas would leave us poorly poised for prosperity's return. A state that draws employers with its quality of life cannot afford these kinds of devastating setbacks. Deep cuts will severely undermine our efforts to protect our environment, our legacy, and our livelihood. An all-cuts budget would force 100,000 people to lose their health insurance overnight. It would push the number of uninsured people in our state past 1 million and abandon our promise to cover all kids in Washington. Is that the state we live in? No! Is that the state is that the future we're going to accept? No! Working parents across the state would lose access to child care, threatening their ability to work.
That's why the Rebuilding of Our Economic Future Coalition, over 100 organizations representing over 1 million Washingtonians, is calling for a responsible approach to the state budget that includes closing tax loopholes and raising revenue. Responsible people around the state realize we cannot continue cutting state services and support for those who have been hit hard by this recession. We must look beyond politics and towards the future of our state. Many of us, thousands of us, have worked hard to pass national health care reform. And we haven't given up that fight. And we are going to win that battle. Meaningful health insurance reform at the national level will help fix many of the state's problems and the individual problems of many of our citizens. Failure on health reform is not an option. But we also know that we can't wait for a victory on health care reform in Washington, D.C. to ensure that we protect our future here in Washington State. And just like we won't let the filibuster in D.C. allow a minority of senators to block health care reform, we won't let I'm an extremist and 34% of the legislature veto our future. We are not going to allow them to slash funding for health care, education, and other necessary services.
Our stories, the stories of families across our state, are at the heart of the need for new revenue. When we say protect our future, it's not just a slogan. It's about the personal stories of millions of Washingtonians. And we're here from every part of the state, from Spokane to Wenatchee to Bellingham to Seattle to Tacoma to Vancouver. We represent diverse communities. We are teachers, nurses, parents, students. We're small business owners. That's right, we are small business owners, and we care about our communities. Yes! Each of us has a story of how deep cuts to healthcare, education, and core services will impact our lives. Today, we want you to hear a few of the stories people from across the state have come to tell. Their stories touch on different issues, but they are standing together today, as we are all standing together today, to say it's time to raise revenue to protect our future.
My name is Teresita Batayola, and I run International Community Health Services in Seattle. I'm here today representing community health centers, which serve as a healthcare home for 700,000 people around our state. We cannot cut our way out of this crisis. Cutting only deepens, widens, and spreads the infection that our bad economy has done to healthcare, to human services, and to education. We know we have legislative leaders who are willing to raise revenue, and we have to support them. If they do not raise revenue, more than 100,000 people, on top of the 875,000 people who lost insurance, will be uninsured. 3,000 of those uninsured who are going to be newly uninsured are our patients in my clinics. And those uninsured are people like the Lee family, whose mom and dad lost basic health last year, and whose 10-year-old and 14-month-old are relying on Apple Health. Mom and dad are no longer coming into the clinic, and they are afraid that if something happens to one of them, or if the income needs are raised for Apple Health, their kids will also no longer have any health care. Our patients are people like Mr. Lee, who is 62 years old, has serious diabetes, and relies on basic health for his doc visits and for his affordable medicine. Our patients include my friend Tina, who had a great career until she lost her job last year, is spending down her life savings and no longer thinks she can afford her Cobra, which costs her over $600 a month. These patients need access to health care. Our compassion has to be action. Let's go for revenue. Let's push our legislators, and let's go for revenue.
I'm Dr. Irit Bloom from Tacoma. I'm a pediatrician and a mom. In Tacoma, we got a wake-up call in October when our city was designated as one of the most 31 polluted places in the country for air pollution. That means more kids suffering from asthma, a serious disease that is difficult to manage. Cuts to air quality, water quality, and toxic cleanup mean much greater costs down the road when more children and adults suffer from environmentally related diseases like asthma. Children's health and the environment are the reasons we need to raise revenue to protect our future.
My name is Miranda Shreve. I live in Cheney, Washington, and attend Eastern Washington University. I'm a double major in government and philosophy. I started my education at the University of Washington, but both my parents lost their jobs mid-year, and even with state financial aid, I could no longer afford to attend. I enrolled at Eastern Washington University because it is the least expensive school in the state. Without the state need grant, I won't be able to finish my degree next year. I want to be a contributing member of society, but where do I go from here if I'm already attending the least expensive school in the state and financial aid vanishes? Higher education and financial aid are the reasons we need to raise revenue to protect our future.